Right, the time being 6 o'clock, I'm going to call the Board of Health meeting to order. All members are present with the exception of Amanda Zompetti. Would everyone please stand and join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. The first item on our agenda this evening are announcements in the Health Department. I will turn things over to Lindsay Wright from the Health Department.
All right. Thank you for having me. I just wanted to let everyone know that this week, the week of July 15th, the Senior Center will be open Tuesday, Wednesday, Thursday from 9 a.m. to 2 p.m. as a cooling center. And the police station community room will be open for the evening and overnight portion from 2 p.m. to 9 a.m. So tonight, Tuesday night, Wednesday night, and then Thursday night as a relief center, a cooling center for residents. Limit any outdoor activities to the early morning and later in the afternoon. Please check on any neighbors that may not be able to get out and may need help being taken care of. If there's questions.
Oh, no, I'm so sorry.
But
thank you.
If there is questions, please give the Health Department a call. We will be happy to assist in any way we can. 781-982-2119. Another big topic that's going on right now is mosquitoes. This area down on the South Shore just had a positive mosquito test for West Nile virus. It was not here in Abington, it was in Rockland. And so something that we're monitoring in town is different pools and standing water. So we're asking residents, if you have pools that are not being used, we would like you to make sure that those are being either completely drained or make sure that the upkeep of them is happening so that there's not standing water and becoming a breeding ground for mosquitoes. Keeping on the theme of pools, Island Grove, the pool over there, is tested weekly from our department, and those results are now posted online through the DPH's website, and we will link after the meeting right to the Health Department's website where you can find the results for those. That is a treated system, and we are in constant contact with Parks and Rec Department Ms. Kelly, and so if there's ever an issue, which there has not been, we would be in constant contact with them, but those results are now available online.
Thank you for that.
Something that we are very excited to talk about is public health emergency preparedness opportunities. We will be looking for volunteers who are interested in some hands-on training, doing some drills, working on some exercises, and that way if the day ever comes that we need to activate a group of volunteers for whatever the situation may be, we have a group of trained volunteers at our ready. So thank you to Susan for helping with that. And if anyone is interested, please reach out either to myself or Susan, and we will get working on that.
Thank you for that too.
Trash carts, annual trash cart fees are due only if you have an additional trash cart. If you do not have an additional one, you can completely ignore me. It is $75 by check or online through Unipay. It's not a quarterly payment, just if you have the additional trash cart. We are seeing an increase in respiratory illness, so we're asking that anyone who is not feeling well to please stay home. And if there's questions, please call us at the Health Department. We were happy to walk through any of the guidelines or answer any questions you may have. I want to remind everyone that public health is the overall health of the community. So help us make sure we continue to achieve this. And lastly, something that we're noticing a little bit of a trend in the Health Department is we're leaving messages for residents who are having whatever they need to get in touch with us about, or we need to get in touch with them about, and calls are not being returned. One of the biggest things that we do in town is infectious disease investigation. And so if we're calling and you've recently had lab work done, it's not always a bad thing. We just always have to follow up on There's about 150 reportable illnesses, and it's no fault of anyone's. We just need to help us, determine where you may have gotten sick from. If it's norovirus, did you eat somewhere that, an employee may have been sick, or was it a student sick? If it's school time, was it undercooked? Did you undercook chicken? Had you been out to eat? Things like that. We're just trying to investigate where different illnesses come from. Some of the ones that we look at are also tick-borne, so we try to see if there's clusters of different tick-borne illnesses, such as tularemia, ehrlichia, and anaplasmosis. Huge words, I know, I'm sorry. So if you do get a call from the health department, please just give us a call back. It will be myself or Eddie that's calling. My lengthy update, but thank you.
Very informative, thank you very much.
Thank you, Lynn. It's good to have you back.
Does anybody have any questions for Lindsay? I'd be surprised if you did, to be honest with you.
No.
No, very
All right.
thorough.
Great. Then we will move on. First, we're supposed to have a public appointment, which I do not see in the audience. Just a little background on that. You do have in your packet a copy of the reduced oxygen packaging without a variance section of the food code. Terranosa Market has requested to vacuum package food. So per the food regulations, the way that they want to do it, the food code I should say, they just need to submit a HACCP plan to us for our approval. They do not need a variance for that because of the nature of what they're trying to do. We kind of got the communication out to them late last week that they could come this evening, and it doesn't seem like that message got to them in time. So we will follow up with them, do this again in August to get this done. They're looking to vacuum package meat for sale. With the way that they're looking to do it, this is the procedure we're going to follow, but that's just the background there for now. Any questions on that?
No.
Not at this time.
Okay. All right. If we get something from them ahead of time, we'll make sure the board has it ahead of time. If there's a couple of different ways we can look at that, we can have them come in, talk about what they'd like to do, and we can have the Board of Health, the Health Department be the one that approves it for us, or we can have them come to us, it's presented to us. That's a decision we can make when they come in, but just so we're all aware. All right then, we'll move past that for now. So the first discussion and action item of the evening is a discussion regarding animal regulations. This is just a carryover from last week, or sorry, wow, 3 weeks ago at this point. It's summertime. Where we left it really was we're gonna have the town council review this, get back to us with any changes so that we know what we're looking at. That has not happened yet due to a couple of different things. But now that we do have 4 of us here, I just want to open up the floor one more time before we try and send it off to get any questions, concerns, comments on it, so we can get that moving forward. So just want to open that up one more time. Any questions about this? We still need to make a decision on rabbits and rodentia, but past that, there's nothing else that is a question of the board to make a decision as far as numbers, unless we don't like any of the fines, if we don't like any of the penalties, any of the things that are set in place. I believe when these were written as a draft, we tried to keep these pretty broad. There's nothing here that limits really number of animals except for the 2 options that we have. There's nothing here that limits anything too much further than we already have it, past the fact that we just want to know what animals people are having. So. And like I said, this is really important that we get this done in a timely manner, as the town meeting did pass the bylaw for us to have a stable fee. And we want to make sure that the stable regulations are in place so that that fee can be used per that bylaw. So now that I've spoken enough for you to think, anybody have any thoughts?
I think we're in great shape. It's very thorough.
Okay.
I didn't see any red flags. I looked
Okay.
at it this afternoon.
All right,
This
so
is the same as last time, right?
Rabbits.
This
yeah,
hasn't
this is
been
the same.
changed?
Nothing's
Yeah.
changed. So great. All right. So we'll move forward with what our plan was there, which was to get town council to look at this. Let us know if there are any changes that need to be made on that front, and come back, and then we can do a deep dive into any of the things we need to do. I know Amanda wants to be part of that discussion, and we were kind of holding out for her because she definitely has the most expertise on this. So we will do that again in August, and hopefully have some answers. Lindsay, can I work with you to get this to Greg?
Mhm.
Thank you. All right. moving forward, discussion regarding pre-rental housing inspections. So this is a continuation of last month as well. Again, we brought this up back in 2022. The board was not for it at the time, just mainly because we didn't have a solid plan in place on how we could make it work in Abington. Jason has been great talking about some process things there, and Jason, I do want to give you some time to talk about what you provided us here in a little more detail. I definitely want to emphasize that we're going to look at this through a public health lens, and we are definitely going to do that probably more in line with some of those resources that we shared before. But all this stuff that Jason's put together is a valuable resource in that, and I do want to give you some time to talk to what you think some of those issues are and what we can do to kind of streamline this process as well. So.
Sure. Well, again, thank you for that. This is a continuation from last meeting. What I thought I would do is maybe put some visual together and get you some documents to take a look at. Would you actually like a copy?
I would love it.
Sure. Right on the table here, Lens, if you want to just, should be a total package there. I've received a formal letter from the fire department asking for assistance in this matter. You know, and I did put them at ease, let them know that we're currently working on something, we're in discussion for it. But I thought I'd bring it to the attention of the board, and that way we can, you know, you want me to take a minute and read? I'll try to be brief. I know it's sticky and hot in here, but I think it's pretty important. This is from Fire Prevention Officer, Captain Cotty. Handles all the fire prevention. He typically will get responded first and then call me out to respond second, you know, to any type of situation that we're discussing now. So I work very closely with the fire department. Commissioner Harris, the Abington Fire Department has seen an increase in fire and life safety issues arising from multifamily dwellings in the past couple of years. We have seen egresses that are blocked, fire protection devices that have been removed, and large amounts of people living in units. These issues have been steadily increasing as the housing crisis in our area proceeds to worsen. From 2017 to 2019, an estimated average of 106,700 multifamily residential building fires were reported to the fire departments within the United States. These fires caused an estimated annual average of 400 deaths, 3,875 injuries, and $1.7 billion in property loss. In the past decade, the Abington Fire Department has responded to over 40 fire-related calls in buildings with 3 or more families. These calls have resulted in 5 multiple fire alarms, 1 fatality, and multiple injuries. When investigating fire safety issues, we normally hear tenants state they were afraid to report safety issues for fear of retaliation, or that they were unaware of the dangerous situation. To properly protect the citizens of Abington, the town's inspectional services need the ability to inspect these properties, not only to keep all residents safe, but also to keep first responders safe. On many of our responses, we have encountered hoarding conditions, storage of dangerous goods, overcrowding, and blocked egresses. All these conditions greatly increase danger to both police and fire. Respectfully, Chris Gotti, Fire Prevention Officer. That was a letter I received from the fire department, and I've just added something to it that I'll just quickly read, and this was my letter to the board, my original letter, but I wanted kind of more the board here so we could get into it. Dear Abington Board of Health, subject, request to implement annual rental inspections. I'm running on this issue on behalf of the building department and fire department to bring to your attention with concern the necessity and importance of implementing annual rental inspections within our community. I am not only the building commissioner for this community, but also a concerned resident. This office has responded to, witnessed, and documented a severe increase in alarming, hazardous, and potentially life-threatening conditions within rental properties for both the tenants as well as emergency services who are charged with responding to these dangerous conditions. As the building official and part of the public safety response team, I believe that regular annual inspections are essential to ensure the safety, habitability, and overall well-being of rental properties. These concerns fall under the jurisdiction of both the building department as well as the Board of Health. The problem and concern of illegal apartments or unsafe living conditions is systemic and pervasive one that places many of our residents in danger while also placing tremendous strains and unnecessary risk on our first responders. Due to the rising costs associated with rentals and very limited number of resources to secure housing, illegal apartment or unsafe occupancies will continue to be an arduous journey that this office has been challenged with addressing. While I understand that this proposal may require an initial investment of time and resources on this department, as well as minor inconvenience to the property owner/landlord, the payoff will be substantial in terms of avoiding the potential unfortunate cost of life and property that can be profoundly avoided with annual inspections. This department, along with the fire department, is asking this board to put forth implementing preventative measures instead of reactionary ones so that we as a team can maintain a proactive approach in dealing with managing future risks while mitigating the current concerns as carefully and efficiently as possible. From there, I kind of go into a couple of benefits annual inspections, and I'll just quickly go through that. Sorry, it's a little bit too long. I know that you guys are hot in here. Ensuring safety and compliance. Regular annual inspections can identify potential safety hazards, such as faulty or exposed wiring, blocked or compromised egress doors, missing or non-functioning fire detection and protection apparatus, plumbing or heating issues, or the lack of basic heat and functionary sanitary fixtures, dangerous structural damages, and fire risks, ensuring that all rental properties and occupancies comply with local building safety and sanitary regulations. One of the major disadvantages this department is facing is locating and properly mitigating unsafe and unsanitary living conditions. Most of the reports received are from reactionary sources such as emergency services. This department has realized from many reports that the tenant feels discomfort to come forward and report these conditions due to fear of retaliation or loss of housing. Another unfortunate situation is that this department is prohibited from intervening with tenants that are causing hazardous and unsanitary conditions. Our only recourse is to enforce onto the property owner. Annual rental inspections will offer immediate relief to these issues. Maintaining property standards. Inspections help maintain the quality and habitability of rental properties, ensuring that landlords fulfill their responsibilities for property upkeep and provide a safe and comfortable living environment for tenants. Annual inspections also ensure that the tenant's responsibilities are met and they are not the primary reason for any identified unsafe and unsanitary condition. Preventing deterioration. Early detection of maintenance, safety, and sanitary issues prevent minor problems from escalating to major repairs and potentially hazardous conditions that will ultimately place the structure, its occupants, and first responders in unnecessary risks that could be avoided. Protecting tenants' rights. Annual inspections serve as a safeguard for tenants, ensuring that their living conditions meet acceptable standards and that they are not subjected to substandard housing or conditions. Fostering community trust. Annual inspections enhance transparency and accountability between landlords, tenants, and local authorities, fostering a sense of trust and cooperation within the community. In closing, I urge the board to consider the importance of taking these preventative measures over reactionary responses. On behalf of the building department and fire department, we appreciate your attention to these concerns, and I look forward to your thoughts on how we can collaboratively work towards the preventative measures or other suggested solutions. And then I just close with, see the attached letter that I've already read
That
from the
was
fire
very
department.
thorough.
Thank you.
You're very welcome.
Underneath these, you'll see some photographs that are attached, just to give you a bit of visual sense of what we're seeing here and why we're so concerned. I think it's the only way to really get a grasp on what we have to deal with here and some of the hazards that we run into. These pictures display anything from unsafe structural situations, egresses that are blocked or compromised where emergency services can't respond.
I like the screw in the electrical outlet.
And so that's actually, what that does is prevents whatever's on that, fuse from popping, to.
I mean,
Oh, you're talking about this one here?
yeah, it's just
So-
like, wow.
Yeah, well, that's supposed to be the mounting screw for the faceplate, but it's actually in the ground location for the electrical outlet.
So that's
Which is pretty
problematic.
dangerous. You can see how it's charred up on the top here, so it's,
Yeah, it really caught my eye.
yeah, you've got an electrical panel located over a latrine, you've got mold issues, you've got water infiltration, you've got single-lined gas venting pipes coming out of a house where a property owner dug his own new gas line to connect. No permits, no inspections. Some very, very dangerous stuff out there.
This would take a lot of time.
Hoarding situations where we walk in and the atrocious conditions where you have 2-year-olds, 3-year-old children running around with, open pill bottles and worse that we've had to mitigate. Folks living in closets, hallways, attics, basements, with no fire protection, missing fire protection and suppression systems, blocked egresses, blocked hallways, enormous amounts of additional fire load. I mean, it goes on and on. I went to respond to one of these calls here, and I walked in the front door. It's missing a floor system. So, and as you continue on, you'll see. And these are rentals, so these folks are unfortunately being subjected to this type of living. This one here, I went to go do a final deck inspection, and it looks to me like I saw, well, that's a great idea, close that in for some under deck storage. And they were very resistant for me to open the door. When I did open the door, I noticed a 5-foot door under the deck that led to an illegal apartment. And that illegal apartment, the image is here, that's the one with the open pill bottles and way worse in there. So we're running into some pretty hairy and scary situations here. A couple of photos that we have here, this is the start of that chestnut fire that we had. And you can see the conditions of the rental unit that started, that displaced 200 folks on the street. So, and again, this is just, the tip of the iceberg of what we're seeing out here, but, it's time, we're in the position here between the board and my position as the commissioner to take a stand. Other communities have either implemented it or on their way to implementing these, and, we're in the position to do something, and I suggest that we get on it as soon as possible before we have some.
Would it be you doing these inspections?
Would have to work that out, whether it be myself or, it would have to be a certified health code enforcement officer, which I believe Eddie just became. We can have outside sources come in and do it. I mean, there's a million different ways to do it. I will let the board know that, I'm bringing this to the board because I would like the board to be involved. As a draft for the 10th edition of the building code, it's actually required to be done now through the building code. The problem with that is, if my office handles all the additional work, a lot of the violations will be split between building code and health code. And so by shipping a lot of those enforcement orders over to your office, you're not going to have the staff to handle it. So we can either bring in an outside per diem help, or we can do it within the departments, but would have to work in tandem and have to figure out how to get that done. There's a lot more discussion to be done about that, but I'm coming down to the wire where, I'm governed by the state, and if the building code is, telling me I have to do this, then it has to be done. So I thought I'd bring it to your attention tonight, and at least kind of continue the discussion and see your thoughts on any ideas you may have on how to work together on this.
I realize how important it is, but it sounds like the real question will be manpower. Like undoubtedly there's a need based on all of these great photos that you attached, but we just gotta figure out how.
Well, there's several ways to do it. You can bring in an outside source, which we already use a regional service to do our restaurants. I have, other sources we can bring in to do that. It can be done internally between the building department and the Board of Health, which I believe that's probably the best way to do it. You have an outside source come in and there's enforcement to be done, it's still going to require building and Board of Health to do it. Right? So it doesn't make sense to bring an outside source. The inspections obviously will cost per year, and so the cost for doing that will cover the inspector and administrative fees for doing that, right? So you get paid per inspection or however it's worked out in the end, but the ability to do it is definitely not going to be difficult to figure out, right? Guidelines to doing that, I think you have some pre-existing guidelines that are in there.
Yeah, so and actually, if I can jump in here, I think the most appropriate way to move forward looking at this might be to draft something up, look at what that is going to entail, and then evaluate the capacity needs off of that, as opposed to speculating kind of a few different ways.
Right.
Because the more we start to do it, the more I think we're going to have some project creep where this thing's just gonna get bigger and bigger, and we need to make sure we narrowly define what's going on, so we can do that here. And I mean, I think one of the things I do want to mention as well is the goal of the program from a public health standpoint is to make sure every renter is assured safe housing, eliminate substandard conditions per 105 CMR 410, and proactive rather than reactive, as well as collaborative relationships with landlords. And as far as the health department's concerned, that's certainly, I think, where our objectives need to be focused on with whatever we design. So I think maybe that's our next step, is let's maybe look at what another community has for a regulation in place.
If I may make a suggestion,
Please do.
the last committee I was in, I was actually heavily involved in it. The process worked seamlessly. If it'd be okay with the board, I'd like to invite my old commissioner in here, who's now, since I left, in charge of the annual inspections. Just to have him come up, speak, maybe answer some questions, explain how the process works down there, why it was implemented, and then answer any questions that you may have from, a third, another source besides myself. But again, this is very concerning. We've been on this for a long time. Emergency services, myself, we've got some fears for this, and it's going to take we're going to get an unfortunate situation that's going to come. You're putting our guys at risk, putting our folks in the community at risk, and this is the stuff that keeps me up at night. So we need to react, and it's obviously we're not alone, because like I said, it's been drafted and implemented into the new building code. So whether I started on my own and then you guys, us as a board, we make the decision, but, once that goes into effect, it has to be done. I have to enforce that. So I suggest that, if we're going to do something in tandem, or that we get, we speak about it sooner rather than later. All right?
Sounds like we'll need additional parties involved as well because of budgeting and everything, so.
Well, the budgeting aspect is out of our hands, and that's where I would want to say to Lindsay, I don't know if you have anything you want to comment on now that you've heard, but I don't want to throw you on the spot. But.
So I think that we need to look at exactly what the guidelines look like. I think that this is something that would be invaluable to us, having responded to many different calls with Jason and the fire department, having gone into home visits and seen some of these conditions firsthand. I think if we can proactively get ahead of things, I am all about being proactive as opposed to reactive. We're going to get a lot further being proactive and using education as a tool. So I think that this needs to be a priority, and from the health department side, we will do whatever we can to support this.
I think it's gonna, it's gonna be taxing for both departments, but there's no other,
sorry.
there's no version of this where we can't do this. It has to be done.
I will say, I think when we started talking about this before, and this may still be the case, is that it's a lot harder up front to figure out where everything is and get things rolling. And once we have that system in place, it's like clockwork.
Correct.
It becomes a lot easier. So it's the upfront part that is the most difficult portion of it all.
As with any big initiative, the initial lift is always going to be heavier, but the dividends that it will pay back the community is worth it. We talk about preparedness and all of that. When we mitigate in emergency management, for every dollar spent, we save up to 13. And so if we think of this as a mitigation effort, for every inspection, you can't put any money, Captain Cotty was talking about lives, and you can't put a dollar value on that, but
Right.
if we think of it in terms of a mitigation effort, if we are thinking of, we go into and see something as simple of a smoke detector is not working, that's $20. So that $20 then it becomes 20 times 13, and then we're doing that all over town. The dividends that it's going to turn around and help will be so beneficial. So
I think there's an expression, when public health is working well, you don't notice.
Well,
so
we're at a point where we need to do something to protect our guys, to protect, the folks in the community, and we are it.
So
So-
we'll make it work.
We have the manpower, we have the technology to implement this, and it's just getting it together. We
Would
need
it be a
communication.
list? Sorry, would it be a list of like every single rental within Abington, and
So-
then you would do each one of those annually?
Correct. So the way that's written in the building code is any non-primary residence being rented is to be inspected annually,
Right.
including Airbnbs, transient rentals, boarding homes. I mean, the list goes on and on. Now, we did a 5-year annual inspection for open common areas, hallways, check for smoke, fire suppression and protection, alarm systems, gain the reports from the landlord saying that the sprinkler system worked, the fire alarm worked, things like that, check for handrail issues. But that's only in the common areas, and that was set for every 5 years. Now, that hadn't been done in this community in 8-9 years before we got here, and we just completed that first round of 5 years. So in another 5 years, we'll go and do the common areas, but this will actually take over for the common area. So it's happening in a lot of communities. There's reasons why. There's a housing crisis, shortage of rentals,
Yep.
and these are just popping up everywhere. And it's unfortunate that it's taken this long for somebody to do something, and all the unnecessary risk we've put our first responders under, and it's unacceptable. And these conditions I walk into, the pictures don't do it justice. They're atrocious, and it's scary. And we're gonna take a stand in our department, so I'm hoping that we can do something together. It's gonna benefit both. Eventually, it's going to flow down where it's gonna hit your department as well. So we might as well do something together and get this taken care of.
So as far as next steps are concerned, can I work with you scheduling, whenever you're,
Sure, absolutely.
yeah?
I put the call out and I said, would you be interested in coming in just to speak on this? I said, we have a meeting next couple of weeks, and he said, absolutely.
Just, yeah, if we can confirm, we can get them on for August even, that'd be fine. We'll do that. And then, after that, once we hit the fall, let's have a draft regulation available for us to review and move forward with. Basically, we probably find another community that we have, maybe we wanna look at what Hull did,
Yeah,
and go from there. Inserting Abington, just seeing how we like things, and then, going back to town council for approval and move on from there.
okay, great.
So, and in the meantime, if health department and building would like to collaboratively work together to
And work
on
out the
some of
logistics of
things
it.
that I think it would be helpful for the board to have that information, just as you folks are prepared to share.
I've done a lot of legwork, I'm pretty much all there.
Yeah.
But again, it's a visual and hearing that you need to see and hear, and how does it work?
Right.
What are the logistics? What are the pluses, the minuses? You need to, how will the inspection get done? What are the charges? You need to know all that, and I have that prepared, but it's better to have a fully functional inspector come in here from another community that has this program up and running for years and years and years, and explain to the community and answer any questions, so.
Any other questions for Jason on this, or anybody? Okay. Then we'll move on. Jason, thank you.
Sure.
Next agenda item is the health agent report. If you don't have one because you had a lengthy thing, that's fine too.
I included everything in
Perfect,
the
that's
initial
fine.
one.
That's fine.
I got overzealous, I'm sorry.
That's okay, we're good. All right then, we'll move forward to the minutes from June 17th. Those are attached. Bear with me as I wrote these this afternoon, just from being away. But I'll take any action or discussion on this.
I have to abstain.
Oh, yeah, that's right, you weren't here. So
Right.
I'll make motion to approve the minutes.
Motion to approve by Susan. Do I have a second?
I will second.
Second for Jason. Any further discussion? All in favor? Aye.
We
Oh.
missed you, Katie.
Thanks.
Opposed? Abstained? I actually didn't hear everybody. Was that all approved on your end?
Yep.
Yes.
Okay, good. All right. I might have spoke too loud. I couldn't hear over myself. My apologies.
Was Amanda here for that?
She was fine.
She was not, so it will be
3:02.
Thank you.
Public comment. Public, do you have any comment? You're good? All right. Correspondence. Does the board or the health department have any correspondence to share?
Do not?
All my stuff was already addressed. I just get multiple questions about the Island Grove testing, and now it's online.
All right. Seeing none, that is the end of our agenda for the evening. I would entertain a motion to adjourn.
I will make a motion to adjourn.
Motion to adjourn by Katie, do I have a
I will
second?
second.
All in favor?
Aye.
Aye.
Opposed? It's unanimous, we are adjourned.